I'm Brad Jackson. I'm currently on the basketball staff at the University of Washington. Prior to that, I was the head basketball coach at Western Washington University for 27 years, and that was my initial introduction and interaction to Dr. Thorpe and to the rest of the docs here at Pacific Rim. His love for sports and his understanding of sports, and also his strong desire to benefit his patients and to help them get back to whatever it is that they were doing and put them in a position where they can be successful, and I think is hard to match. He also, I think he understands too the dynamic with an athlete maybe is different than a person that would not be in a highly competitive situation, and so consequently the procedure, understanding exactly what to do, how to do that best, and then putting them again back into a position where they're rehabbing properly, having the proper care in that form or fashion, where he sees the patient all the way through. I think has been just outstanding in his relationship with the athletic department. When you're a coach, oftentimes it's a lonely position, and you're in a position where a lot of people think they know what's going on, or everybody has opinions, and that's great. But I think one of the other things that I always appreciate about Dr. Thorpe was, in my position here at Western Washington, was the fact that we could talk about not only basketball, but observations that may relate to the performance of a player or the team. And I think because of his basketball experience, because of his viewpoints coming from a position of a doctor, and also as a parent, he combined those things really well. And I think that I was very fortunate in the position to be able to have someone that I could interact with, that could be honest, that could see things maybe that I couldn't see. And I think we just gained a lot from each other through that experience, and hopefully our teams were better and the kids were better. And one of the things that I always really appreciated is that we really felt like our players were very well taken care of. And if there ever was a concern or an injury or even a potential injury or overuse type things, I know I could talk to Mike, and it wasn't come in, sit down in the office, kind of talk to Mike, but it was call at midnight, or we talk at various times, and I think that kind of relationship, certainly for me as a coach, and then knowing that my players were extremely well taken care of, was something that not everybody experiences.